Picture this. It's a 1:47, and a wounded crusader arrives at the monastery of Saint Denis outside Paris, bleeding from sword wounds and burning with fever from infection. Within hours, he's lying in a clean bed in a specialized infirmary, receiving herbal medicines prepared by monks who understand pharmacology better than most university physicians, and being cared for by brothers who have dedicated their lives to healing the sick. This isn't exceptional charity, but standard practice at a medieval monastery that has transformed itself into Europe's most advanced medical institution. The monks have herb gardens that rival royal apothecaries, surgical knowledge gained from treating battlefield injuries, and patient care systems that ensure round-the-clock medical attention. How did these religious communities become medical pioneers? What drove monks and nuns to develop healthcare systems that would define European medicine for centuries? The answer lies in a unique combination of Christian charity, practical necessity, and intellectual curiosity that transformed medieval monasteries from simple prayer communities into comprehensive medical institutions. Monastic communities understood that caring for the sick was both a religious obligation and a practical requirement for maintaining their own health and economic viability. They developed sophisticated healthcare systems that combined spiritual healing with practical medicine, creating hospitals that were often more effective than secular medical institutions. Medieval monastic medicine began with the fundamental Christian teaching that caring for the sick was an essential religious duty that could earn spiritual rewards while demonstrating practical charity. This theological framework created powerful motivations for developing medical expertise and dedicating significant resources to healthcare provision. Monasteries interpreted healing ministry as direct participation in Christ's work, making medical care a form of active prayer and spiritual devotion. The economic advantages of providing medical services created sustainable funding models that allowed monasteries to maintain expensive healthcare operations while generating revenue that supported other religious activities. Wealthy patients paid substantial fees for premium medical care, while charitable treatment of the poor demonstrated religious virtue that attracted donations and bequests from grateful communities. But here's where monastic medicine becomes truly revolutionary. These religious communities developed systematic approaches to medical education, pharmaceutical research, and patient care that anticipated many principles of modern healthcare delivery. They created the first organized medical training programs, established standardized treatment protocols, and maintained detailed medical records that advanced understanding of disease and healing. The herb gardens maintained by medieval monasteries were sophisticated pharmaceutical operations that required extensive botanical knowledge, careful cultivation techniques, and precise preparation methods that could produce effective medicines from natural ingredients. Monastery gardens contained hundreds of medicinal plants, each requiring specific growing conditions and harvesting timing that monks studied and perfected over generations. The pharmaceutical knowledge developed in monastic communities was remarkably advanced and often exceeded the medical understanding taught in universities. Monks studied ancient medical texts, conducted experimental research with plant medicines, and documented treatment outcomes that created comprehensive medical databases. They developed standardized recipes for medicines, created quality control procedures for drug preparation, and established dosage guidelines based on careful observation of patient responses. These monastic pharmacies operated with scientific precision that rivaled modern pharmaceutical operations. Monks understood drug interactions, contraindications, and dosage calculations that required mathematical knowledge and careful record-keeping. They developed preservation techniques that maintained drug potency for months or years, created standardized measuring systems that ensured consistent dosages, and established safety protocols that protected both patients and medicine preparers from toxic substances. The timing of medicine preparation followed seasonal cycles that maximized plant potency while ensuring year-round availability of essential medications. Spring harvesting focused on young leaves and shoots. Summer collection emphasized flowers and fruits. Autumn gathering concentrated on roots and seeds, while winter preparation involved processing and preserving medicines for storage. This seasonal approach required detailed knowledge of plant biology and pharmaceutical chemistry that took decades to master. Monastic medical libraries preserved and transmitted classical medical knowledge while adding original research that advanced understanding of anatomy, disease, and therapeutic techniques. These libraries contained works by ancient physicians like Galen and Hippocrates, alongside original treatises written by monk physicians who combined classical learning with practical experience gained from treating patients. The copying and translation work performed in monastic scriptoriums ensured that medical knowledge survived the collapse of classical civilization while being transmitted to future generations. Monks translated medical texts from Arabic, Greek, and Latin sources, creating comprehensive medical libraries that were often more complete than those found in universities. They added marginal notes based on their clinical experience, corrected errors in ancient texts, and produced illustrated medical manuscripts that enhanced understanding of anatomical and therapeutic concepts. The patient care systems developed in monastic hospitals created the foundation for modern nursing practices through systematic approaches to hygiene, nutrition, and round-the-clock medical attention. Monks developed schedules that ensured continuous patient monitoring, created protocols for medication administration, and established procedures for managing different types of medical conditions. Monastic hospitals were among the first medical institutions to recognize that healing required attention to both physical and psychological needs of patients. They provided spiritual counseling alongside medical treatment, created peaceful environments that promoted recovery, and developed patient comfort measures that reduced suffering while supporting natural healing processes. The daily routines established in monastic hospitals followed structured schedules that balanced medical care with religious observance, creating healing environments that addressed both body and soul. Morning prayers preceded medical rounds, midday meals featured foods selected for their therapeutic properties, afternoon activities included occupational therapy and gentle exercise, while evening prayers provided comfort and spiritual support for suffering patients. Patient classification systems developed in monasteries organized medical care based on condition severity, treatment requirements, and recovery prospects. Acute patients received intensive monitoring and frequent medication. Chronic patients participated in long-term treatment programs. Surgical patients followed specialized recovery protocols, while terminal patients received comfort care and spiritual preparation for death. The architectural innovations introduced in monastic hospitals reflected sophisticated understanding of how physical environments affected patient recovery and disease transmission. Monastery infirmaries featured large windows for natural lighting, efficient ventilation systems that reduced infection spread, and layout designs that facilitated patient care while maintaining hygiene standards. Heating and sanitation systems in monastic hospitals were far more advanced than those found in secular buildings, reflecting understanding that temperature control and cleanliness were essential for patient recovery. Some monasteries developed central heating systems using hypocaust techniques inherited from Roman engineering, sophisticated drainage networks that removed waste and contaminated water, and waste management procedures that prevented disease transmission. Water supply systems in monastic hospitals ensured access to clean water for drinking, cooking, and medical procedures through wells, springs, and aqueduct systems that were carefully maintained and regularly tested for purity. Monks understood that contaminated water caused disease and developed filtration and purification techniques that provided safe water for patient care and pharmaceutical preparation. The specialization that developed within monastic medical communities created the first organized medical professions, with defined roles, training requirements, and performance standards. Different monks specialized in pharmacy, surgery, patient care, and medical research, creating teams of specialists who could provide comprehensive healthcare services. Surgical knowledge in monastic hospitals often exceeded that available from secular practitioners, because monks had opportunities to study anatomy, practice procedures, and learn from experienced colleagues in ways that individual practitioners couldn't access. Some monasteries became renowned for specific surgical specialties and attracted patients from across Europe seeking advanced treatment. The surgical training programs developed in monasteries combined theoretical education with practical experience under supervision of master surgeon monks. Students learned anatomy through dissection of animals and occasional human cadavers, practiced surgical techniques on training models, and gradually progressed to assisting with operations before performing procedures independently under continuing supervision. Surgical instruments used in monastic hospitals were often superior to those available to secular surgeons because monasteries could afford to commission custom instruments from skilled metal workers and maintain them properly through dedicated craftsmen. Monks developed specialized instruments for specific procedures and created maintenance protocols that ensured surgical tools remained sharp, clean, and reliable. The women's religious communities that provided medical care developed particular expertise in obstetrics, gynecology, and pediatric medicine through their roles as caregivers for women and children who often couldn't access male physicians. Convents operated specialized hospitals for women and created medical knowledge specifically related to women's healthcare needs. Female religious medical practitioners often possessed knowledge about contraception, abortion, and fertility treatments that was unavailable from male physicians due to religious and social restrictions on discussing reproductive health. Nuns developed expertise in managing difficult pregnancies, treating gynecological disorders, and providing prenatal and postnatal care that saved countless maternal and infant lives. The international networks connecting different monastic communities created systems for sharing medical knowledge, exchanging pharmaceutical recipes, and referring patients to institutions with specialized expertise. These networks facilitated rapid dissemination of medical innovations and created standards of care that influenced healthcare practice across medieval Europe. Medical correspondence between monasteries included detailed case studies, treatment protocols, and pharmaceutical formulations that allowed rapid sharing of medical innovations across vast geographical distances. Traveling monks carried medical knowledge between institutions, while pilgrimage routes facilitated patient referrals to monasteries with specialized treatment capabilities. The teaching hospitals operated by monasteries provided medical education that combined theoretical knowledge with practical experience in ways that universities couldn't match. Student monks learned medicine through direct patient care under experienced supervision, creating training programs that anticipated modern medical residency systems. Medical education in monasteries emphasized both intellectual understanding and practical skills through curricula that included anatomy, pharmacology, surgery, and patient care techniques. Students spent years learning under master physicians while providing supervised patient care that ensured competency before independent practice. The research conducted in monastic medical institutions included systematic observation of disease patterns, experimental testing of treatments, and documentation of medical outcomes that advanced scientific understanding of health and healing. Monk physicians maintained detailed case records, studied epidemic diseases, and developed preventive medicine approaches that reduced community health risks. Experimental medical research in monasteries included testing new pharmaceutical preparations, evaluating surgical techniques, and studying disease transmission patterns that contributed to scientific understanding of medical phenomena. This research was often more systematic and better documented than work conducted by individual practitioners who lacked institutional support and resources. The epidemic response capabilities developed by monastic hospitals made them essential institutions during plague outbreaks and other public health emergencies, when their organizational skills, medical knowledge, and charitable mission provided coordinated healthcare responses that saved thousands of lives. During epidemic periods, monasteries transformed into emergency medical facilities that could handle massive influxes of patients while maintaining infection control procedures that protected both patients and medical staff. They developed triage systems that prioritized treatment based on condition severity and survival prospects, established quarantine procedures that prevented disease spread, and coordinated with other institutions to maximize regional healthcare capacity. Emergency medical services provided by monasteries included trauma care for accident victims, poison treatment for those who had consumed toxic substances, and emergency surgery for patients requiring immediate intervention. These services were often the only available medical care in rural areas where secular physicians were unavailable. The mental health care provided in monastic institutions recognized psychological disorders as medical conditions requiring treatment rather than spiritual failings requiring punishment. Some monasteries developed specialized programs for treating mental illness that emphasized compassionate care and therapeutic intervention rather than restraint and punishment. Psychiatric treatment in monasteries included occupational therapy, music therapy, and structured daily routines that provided stability for patients with mental health disorders. Monks understood that mental illness often had physical causes and developed treatment approaches that addressed both psychological and physiological aspects of psychiatric conditions. The pharmaceutical manufacturing operations conducted by monasteries included large-scale production of medicines that were distributed to other institutions and sold to support charitable healthcare operations. These pharmaceutical operations maintained quality control standards and developed distribution networks that made medicines available across wide geographical areas. Medieval monastic medicine established precedents for modern healthcare delivery, medical education, and pharmaceutical research that continue to influence contemporary medical practice. The emphasis on compassionate care, systematic treatment approaches, and combination of scientific knowledge with humanitarian mission evolved directly from monastic medical traditions. Most importantly, medieval monasteries demonstrated that effective healthcare requires both technical competence and compassionate commitment to serving human needs regardless of patients' ability to pay for services. They proved that religious motivation can drive medical innovation and create healthcare systems that serve both individual patients and broader community welfare. So how did medieval monasteries become Europe's first hospitals? They combined religious obligation with practical necessity to create comprehensive healthcare systems that provided medical education, pharmaceutical research, and patient care services that were often more advanced than secular medical institutions could offer. They understood that healing required both spiritual and physical intervention, creating integrated approaches to healthcare that treated patients as complete human beings rather than simply medical conditions. They developed sustainable economic models that allowed them to provide charitable care while maintaining high standards of medical practice. creating healthcare institutions that served their communities for centuries while advancing medical knowledge that benefited all of European society. The next time you visit a modern hospital or appreciate the integration of compassionate care with advanced medical technology, remember the medieval monk who combined prayer with pharmacy, developed surgical techniques while copying medical manuscripts, and created healthcare systems that proved religious devotion and scientific inquiry could work together to heal human suffering and advance medical knowledge for the benefit of all humanity. If you enjoy the hidden sides of medieval life, hit subscribe and give this video a like.